So what if your iron is not really the problem, but the clue? Let's talk about a patient whose iron numbers were low. Instead of simply giving her iron supplements, we focused on finding why her iron was low in the first place. After addressing the underlying cause, her hemoglobin normalized, her iron levels improved, her body is now rebuilding its iron stores without taking an iron supplement. Many people are told your iron is low, so just take some iron. Sometimes iron supplements are absolutely necessary, especially when someone has significant iron deficiency, anemia, or dangerously low blood counts. But supplementation should not replace your investigation. Because the bigger question is, why is the iron low in the first place? Or, if we only keep replacing what is missing without addressing why it became low, we may temporarily improve the numbers while the real problem is continually growing and maybe even getting worse. It's like constantly pouring water into a bucket without actually repairing the hole. So what are some of the possible causes of low iron? Low iron can be developed for many different reasons. One could be poor digestion or low stomach acid. One could be inflammation in the digestive tract. Another can be poor nutrient absorption. Another could be heavy menstrual bleeding or another loss of blood. Celiac disease or other digestive concerns can also cause blood loss. Gut infections, imbalances, not eating enough iron-rich foods, or difficulty actually absorbing iron itself. That is why low iron should be viewed as an important finding that deserves a complete evaluation. Not always just simply giving a supplement. Instead of looking at only one iron number, we reviewed the patient's symptoms, health history, digestion, dietary intake, menstrual history, and laboratory patterns. We evaluated markers such as hemoglobin, ferritin, serum iron, iron saturation, total binding capacity, red blood cell size and hemoglobin, and markers of inflammation. This helped us better understand whether the patient was losing iron, failing to absorb it, or actually having difficulty using it. Let me show you what actually happened. This was her before results. Her hemoglobin, her iron markers were below the levels we wanted to see, showing that her body did not actually have the iron support it needed for healthy red blood cells. Instead of simply feeding deficiency with more iron, we worked on the underlying factors that were contributing to the problem. Now, in her case, it actually happened to be a gut balance issue. Check out her results after. Here you can see her hemoglobin has now normalized, which means that her body is once again producing healthy red blood cells and carrying oxygen more effectively. Her iron levels have actually improved. Her ferritin, which it reflects a stored iron, is beginning to rebuild itself again. Now, iron storage can take a little longer to recover than hemoglobin, so we want to continue to monitor her progress where her body replenishes itself. Her blood levels have recovered first, and now her body's starting to rebuild its iron reserves. Now, why is it that ferritin may take a little bit longer? For you providers out there, this is important because serum iron and hemoglobin may improve before ferritin fully returns its function. Ferritin reflects the iron that the body is stored for future use. Think of hemoglobin as the iron being used on a day-to-day basis, while ferritin is the body's savings account. The immediate need may be corrected first, but rebuilding the savings account can take a little bit more time. That is why we do not stop evaluating this patient just because one or two numbers have normalized. We want to confirm that your body can maintain healthy blood production and continue to rebuild its iron reserve. This case does not mean that everybody with low iron should avoid iron supplementation. Some patients actually need iron replacement, and no one should stop prescribed iron without first speaking to their medical provider. But this case does show why it's so important to investigate the true causes. Is the patient losing blood? Is the body failing to absorb iron? Is the inflammation interfering with iron metabolism? Is digestion impaired? Is there an underlying gastrointestinal issue? Because when you identify and address the real drivers, you give the body an opportunity to correct the problem instead of becoming permanently dependent on a repeated feeding schedule. In closing, The goal should not be to chase one or two laboratory markers. The goal should be to understand why the numbers became abnormal, address the underlying problem, and confirm that the body is responding appropriately. This is the difference between feeding the problem and treating the cause. If your iron, ferritin, or hemoglobin has remained low, or if you've been taking iron but the problem keeps returning, do not ask only, what supplement should I take? Ask questions like, why is this happening? At In Harmony Functional Medicine, we help patients look beyond the surface. As always, ask how we can help.